Good evening. Thank you for coming in. I know it's not always convenient to have to do these medical exams, but we need to make sure that you're going to fit inside your spacesuit and make sure you're in good physical health before we send you on your way. So I'm going to start with standard procedure. Let's go ahead and decontaminate. Make sure that everybody is as clean as we can be. Thank you. Now, if it's okay with you, I'd like to get a little bit close, go through the standard decontamination process, and just put this mask over your face, and then we'll do the sterilization for the entire body in just a moment. Okay? And this may be a little bit bright. If it's convenient or more comfortable to close your eyes, please feel free, okay? Thank you.
Okay, hold very still. Okay,
Thank you.
I think we're good.
Okay.
Okay, doctor. Right?
Yes.
Okay. We'll go ahead and do your full body scan. Okay, and we'll need for you to hold as still as possible. Very, very still, please. Almost there. A little more there. Okay, we've got you.
Thank you. All right. And that'll measure for things like bone density, general health, and to begin, just gonna have you drink some supplementation here. And that'll be working through your system as we continue. Just give it a couple of moments to dissolve. A couple of additional supplements that we're going to want you to take before we get you on your way. Just going to place it there beside you here.
Which flavor is that?
I think that's going to be the strawberry watermelon.
Oh, that's a good one. You'll like that one.
Alright. And if you don't mind allowing me to see one of your fingers here. Oxygen meter. Okay. Just leave that there for a couple of moments. Is that comfortable? Okay, thank you. I'm going to start with some standard breathing exercises. I just want to hear your respiration, also listen to your heartbeat. And so at the moment, I want you to just go ahead and breathe as normally as you are able to. Reach around to your back. Okay. And again to your other side. Just around to the back. All right. And listen to your heart rate. Your species has a unique heart with 5 chambers, so this sometimes takes a little bit longer. Okay. And if you can, please take a deep breath in for me. Hold it. Okay. And again. And again. One more time for me here. Okay. Just going to continue listening to your heart rate. Very nice, strong heartbeat. Respiration sounds good.
Did you notice that value there?
Mm-hmm.
Yeah, I found that a little bit interesting.
Okay.
Thought you might want to see it. Was there anything else from the results you wanted to see, or does that seem like the most important thing that we wanted to know?
That's probably the most important
I
one.
think so too. Thank you, doctor.
All right, and just taking a look at your oxygen meter. That does seem normal. Alrighty, and go ahead and, if you don't mind, taking a couple of drinks of that. See if we can get that in you.
I thought you'd like that one. It's always the popular one.
Mm-hmm. Okay. I'm gonna put our second dose in there. Pretty tasty one. The grape is also pretty good too. And while we are focused on your supplements, I'm going to go ahead and give you a couple of necessary vaccinations before we send you out into space. Give me just a moment while I put some gloves on. Do you have any arm that you prefer? Okay. Thank you. And just one more. Do this one a little bit lower.
How many units was that, Doctor?
We're at 60 cc's,
Okay, thank
or
you.
60 units
Thank you.
on the first and 60 on the second.
Thank you. Okay, documented.
Thank you. And please, if you do notice that there's any adverse side effects to that, let us know as soon as possible, okay? On to more of the nervous-related testing. I want to first start with your eyes. And just see if you have any blockages, any cloudiness, anything at all that we need to be aware of or have adjusted before we send you out. So if you don't mind, just go ahead and look forward and blink as normal here. And I'm going to very gently touch your skin just around your eyes. And you please let me know if that is uncomfortable in any way, okay? Okay. And can you look to your left for me? Okay. And now your right. I'm going to pull up on both of your eyelids. And can you tilt your head back just a little bit? And do you ever experience eye fatigue, redness, burning, swelling, any allergies that you know of? Alright, I'm going to continue just to palpate around the skin here real quick. Just feeling for anything that would be abnormal. Taking a good look at your skin as well. And how about your gills here? Any stuffiness, complications with your gills that you're aware of? We also want to make sure that those are functioning as they should be. And if it's okay with you, I'm going to get a little bit closer. I want to examine your skin very, very closely. We've had a lot of Centaurian ticks lately and parasites. We just want to make sure that if there's anything small that's hiding somewhere that we can get it. So I'm going to start with that aspect, looking on your scalp and around your gills, around your ears. See if there's anything in those tiny areas that we don't expect them to be in. Is that okay? Okay. I'll get a little bit closer to you.
How's the tissue?
Tissue looks good, hydrated.
Okay.
Don't have any dry flakiness.
Thank you.
That's very unusual in space. Your skin has been doing very, very well.
Anything else you want to document it on the gills?
Nothing that's visibly unusual. We'll get to
Alright, healthy tissue it is. Thank you.
tissue, indeed. Nice and moist. Just checking the edges here. Around your shoulder areas here. Nothing remarkable. Do you mind lifting your arm just a little bit for me? Thank you. All right. Okay, that looks good. Take a good look into your ears. I'm gonna flip your or pull your gills forward just a little bit here so that we can see on the underside. I'm gonna use my otoscope. So if you don't mind just relaxing, might be a little bit cold. Okay, I'm just gonna pull forward a little bit here. Is that uncomfortable at all? Okay, that's good. Okay, how about right here? Okay. And here? Excellent. Okay, other side here. Tissue looks clean.
Thank you.
And just pulling forward a little bit here. Does this cause any kind of discomfort? And how about here? And out here. All right. Visually, everything looks good.
Does that all look correct so far?
Mm-hmm.
Thank you.
Thank you.
Should we do radiation?
Yes, I think
Okay.
radiation's the next step.
So go ahead and back out of there.
Yes. Then I've let Dr. Lauren take over for this testing.
All set? Okay, well, we know how this works. Take a deep breath in. Out. Deep breath in. Out. Level 3. Here we go. Do you want to try level 4?
Yeah.
How long are you going to be out? Level
Yeah.
4. Okay, deep breath in. Out. Deep breath in. Out. Okay, ready. Okay, very good. Do you want to examine?
Yes. And in this next test, we're going to use a unique diagnostic tool to test the sensation of your antennae, and some patients state that this is a little bit tingly. Sometimes it's hot, sometimes it's cold, sometimes it's neither. And please let us know what your perception of that is, okay? Okay. I'm going to start at a very low setting. And on this side. And did you experience any perception of temperature, hot, warm? No? Okay. How about the tingling sensation? Did it seem more of a tickle or electric? Okay. We're going to increase the power just a little bit on that and see if that changes your perception a little bit. Okay. Again. Just slide that down a little bit. How does that feel? A little bit of a tingle? Okay. Tingly? Okay. Anything that would have been an irritation? No? Just a little bit tingly. That's good. Just a couple of other preliminary testing. We want to test your perception of sound, different vibrations, the perception of vibrations. We're going to start with that. Just tuning fork. And if you would please close your eyes and tell me when you can feel the vibration hit your skin. Good. Now I'm going to have this get close to your ear so that you can hear that vibration. And I want you to tell me when you can hear the audio or the sound of it stop, okay? And keep your eyes closed. Excellent. Wonderful, thank you. Testing some of your reflexes here. If you wouldn't mind just holding your arms out for me here. And does any of this cause any discomfort or pain? Good. shoulders. Normal reflexes in the torso. Okay. I'm gonna try with your kneecaps. So I'm gonna back up just a bit. And just let your legs go limp here. Normal responses on both kneecaps. Wonderful. We're going to do a little bit more testing on your gills, make sure that they're respirating the way that they should be. And what this is going to do, we're going to take a special fluid and spray it onto the surface of the gills. We want to make sure that we can see the response from that. Do you feel any difference in your ability to utilize your gills at the moment? Great. Alrighty. Last bit that we're going to focus on with a lot of your nerve and face testing here is we're going to take a good look at your mouth, make sure that your teeth are in good condition. You're going to be away from any kind of dental expert for a little while, so we want to make sure that your teeth and mouth are in good physical health. Do you mind passing me the light? Thank you. Can you just start by opening up your mouth and going, ah? I'm gonna just stick my thumb in your mouth and use that on the outside or the inside of your cheek here. Is that okay with you? Okay. Just feeling for any kind of sores.
Surprised you're willing to do that after our last patient.
Trust me, it's not without a little hesitation. On the side.
Not that you would ever bite a doctor, of course, but,
Of course
you know.
Now everything looks good. And stick your tongue out for me. Okay. And do you mind moving it to one side? And then the other? A little bit of a dental cleaning here, just to get any bit of residual that you might have. So if you would please just open up. front teeth. And your bottom row. It's a super efficient tool. How's that feel? Good. That's all that we need to focus on in your mouth. I'm actually going to go back to the visual testing here. So we're going to go back. I no longer need my gloves. We're going to test your peripheral vision. But first, what I want to do is I do want to also test your constriction here on one eye. And go ahead and take a minute and go ahead and blink. Okay. You can do the same with your other side. I want you to follow my light. Hour. So now, just want you to stare forward, stare at my nose, and I'm going to have Dr. Lauren here. I'm just going to be testing your peripheral vision, and you tell me when you see one of her fingers come wiggling in into your peripheral vision, okay? And do you think that you can do the test with the peripheral vision, bringing the finger in? Okay. Okay. Just let us know when you see the finger wiggle. Excellent. Thank you. Just looking forward here. I'm going to have both of my fingers in your slight peripheral. You tell me which side of the fingers are wiggling, left or right. Excellent. Nothing inaccurate there. Okay, that's the medical aspect of everything. And the next bit is let's get you measured to make sure that you will fit into your spacesuit. And if any adjustments are needed, we can document those and get the adjustments taken care of before you leave. Okay, so just go ahead and stand with your normal posture if you may. Start by measuring the width of your shoulders. Okay, 59 centimeters. And then just with your head being at comfortable height, just look forward here. And we're at 23 for the collarbone from the chin. Okay. Circumference, partial circumference from one side of the ear to the same side. the distance between your tear ducts here. About 3.5 on the duct to duct. Okay, the height of your right eye. Looking at 3.5 on the height. And 3.5 on the left. Alright, I'm going to wrap around the back of your neck here. Circumference is 43. And around your head, and this is to know the circumference of your helmet. Okay. And we're at 72. Top of your shoulder. Down to your elbow. Okay, we're looking at 35 on the right. And 35.5 on the left. Okay. And just relax your mouth here. And we're looking about 6 on. And from the very top of your hairline to your chin. Looking at 25. Edge of the eye to the other eye. 18. Wrap this around your forearm. Okay. 27 on the right. $27 on the left. The length of your forearm. 32 on the left. 32.5 on the right. Okay. Do you mind lifting your arms up just for a little bit here while I wrap this around your chest? Okay. Okay, and about 88 on the chest. And down to your waist. 88 on the waist as well. Alrighty, I think that gives us everything that we need on the measurements. We still have a couple of those tests that we'll wait on the results, but they should be within the next couple of hours. If there's anything that needs to be addressed or concerned, we'll follow up with you. But otherwise, on the surface, you look like you're in good physical health. And once we get those test results back, if you're ready for release, we'll get you going. It's been a pleasure, and I hope that you will have a safe and enjoyable experience.